Hello and welcome to the Doc Podcast. I'm your host, Dr. Mike DeLuke, and it's my mission to help you lead a happier, healthier, and more prosperous life, both personally and professionally. Hello and welcome to this episode of the Doc Podcast. Today, my guest is Dr. Bret Christensen. Bret is an Army veteran who currently owns and operates Christiansen Orthodontics with locations in Lewiston, Grangeville, and Moscow, Idaho. He has been helping treat patients who suffer from sleep-disordered breathing since becoming an orthodontist back in 1999. And his focus, which I love, is on addressing the etiology of the malocclusion, not just treating the symptom or trying to line up and straighten crooked teeth. In May 2019, Bret received diplomat status with the ASBA, the American Sleep and Breathing Academy, and became one of 5 orthodontists in the country to become board certified in sleep medicine. Bret understands that in order to effectively manage airway issues, we must first know what is actually causing the airway obstruction, and I completely agree with that philosophy. We're going to talk about his approach in detail during today's show. And Bret also opens up about his personal journey, including some of the recent health struggles he's been contending with, and how all of that ties into sleep and breathing. This is truly an amazing and emotional episode that you do not want to miss. We even have a surprise guest who comes to visit Bret during the show. I also have a big and exciting announcement to make. Many of you have told me that I should offer a hands-on training course to teach my Phase 1 early archwire expansion technique. Well, I listened, and I'm excited to announce that this November 6th and 7th of 2026, along with my good friend and fellow board-certified orthodontist, Dr. Daniel Camacho, a previous guest on the show, I will be running a 2-day comprehensive hands-on CE course on how to approach early, airway-focused orthodontic treatment. The didactic portion will include information on detecting and managing pediatric patients who suffer from sleep-disordered breathing, taking and interpreting CBCT images, referring to and coordinating care with your medical colleagues, the diagnostic and treatment planning process, how to train your team, how to educate parents, how to handle billing and insurance, and much, much more. In the clinical portion, you'll get hands-on exposure to the new patient exam and consultation process, braces placement, and adjustment visits live on site in Dr. Camacho's office. This is going to be an amazing event. And because we really want the course to be immersive and personalized, we are limiting the number of attendees to 20 docs. Yes, that's it. 20 docs. So be sure to save the date, November 6th and 7th, and keep an eye out for when registration opens because the spots are going to go quickly. Thanks so much. And without further ado, let's get on to the Doc Podcast with Dr. Bret Christensen. Enjoy the show, everybody. Welcome to Doc Podcast, Bret.
No, good to see you this morning.
Great to see you. Thanks for joining me early there on West Coast time in Idaho. We're going to talk about your practice quite a bit during today's episode. It's pretty cool what you are doing out there. Before we do that, and you can even go into the practice a little bit as you go into your history, I love to hear about people's journeys. You've had a really, really cool journey over the past 3 decades in the orthodontic profession, in the dental profession, actually, I should say. So if you don't mind, tell the audience a little bit more about who you are, how you got to this point in your life and your career.
All right. Well, I mean, if you go way back, I'm a farm kid. So I grew up on a farm milking cows, and we calved out 100 cows every year the whole time I was growing up as a kid.
Wow. Was that your dad that started the farm?
My dad, long-term, I mean, my grandfather was born in 1900, had a ranch in Teton Valley, and we, you know, my dad's still got a ranch there, although he doesn't get to do stuff. He's almost 90 now, so
wow.
We go down and help him with stuff. But no, I mean, I just grew up as a farm kid, but my parents are both educators. My mom was a teacher, and you know, they always just instilled in us that we needed to learn, and I know we didn't think we struggled as kids. You know, we thought it was great, but my parents, you know, they wanted us to get the best education. And it's interesting, I have 4 brothers and sisters, and we're all in the medical field.
Really?
Yeah. brother that's an orthopedic surgeon, a sister that was a dental hygienist, me as an orthodontist, my little brother's a dentist, and my little sister is a physician assistant.
Wow. Very interesting. That's so interesting that was instilled in all of you, coming from a farming background. Yeah, well, sure.
Yeah, we all learn how to work hard.
Yep.
And so we're kind of all workaholics. And so, but yeah, growing up, I always thought I was going to be a veterinarian.
Interesting.
And so, because I grew up around animals and stuff. And I remember my dad telling me one time, because I had a couple uncles that were dentists, and he told me, he says, I know you want to be a veterinarian, you want to work with animals because that's, what you like. And he says, but how many veterinarians drive a nice truck? And I was like, none of them. He said, so what you really should think about is doing something, in the medical field and make enough money so that you can spend time with, doing things with animals. And, I still have animals. Right now I'm down to 7 horses. At one time I had 50 horses.
7, wow.
We were breeding and doing embryo transfers, and I was competing on the world stage in reining.
Wow, that's pretty. I didn't know any of that, Bret. That's fascinating. I knew you had farming background, but I didn't know it to that extent. That's cool.
Yeah, we at one time were in the top 10 in the world in the QHUE world standings with a stallion that I had in the reining world, and so. But, it takes quite a bit to do that kind of stuff, and dentistry's been good to me. Yeah. But, growing up being a farm kid and everything like that, it's interesting when you talk about, going to school and everything. I decided, right out of high school that I wanted to go ahead and be a dentist. Okay. And so I focused on that going into college. And most people go off and get a bachelor's degree when they, getting into a dental school. I did 2 years of undergrad and then applied to dental school. Really? I got all my prerequisites done. I had an associate's degree, applied to dental school at Creighton, and they accepted me to go to dental school, only having an associate's, but I had to finish organic chemistry. And it was interesting. They said, well, we're going to accept you to come to our school, but you got to go take organic chemistry this summer. And it was a 9-week course. And I had to go down to Utah. I just got married, sent my wife to Alaska, worked in the fish cannery so we could make some money. And I go down and I take the first term, which is 3 weeks, just nothing but organic chemistry. And the second 3-week session, I got A's in both of those, and I called up the school and I said, hey, I got A's in both of these terms. There's 3 more weeks. I said, you guys just want to know that I know how to learn, right? And they're like, yeah. And I said, do I have to take these last 3 weeks of organic chemistry? And they said, no, you've proven to us that you know how to learn. And so I didn't have to take the last 3 weeks of organic chemistry. Wow. And I went off to dental school. And so when I was in dental school, I was like, man, this stuff's expensive. In today's world, it'd be pretty cheap. I was back there 30 some odd years ago. And in the state of Idaho, they have a program that, because Idaho doesn't have a dental school, they'll help pay for it. So it's called the IDA program. And so I got into that. And the state of Idaho was helping me with dental school. And then 2 years into it, I joined the military. And the military then picked up my last 2 years as long as I would go back and give them some time. And when I was in dental school, I really figured out that I didn't really want to be a dentist. I wanted to be an orthodontist. Most dental students would go up to the orthodontic part of the school and they would do 1 or 2 cases. I did 15 in dental school.
Did you just like the mechanical nature of it? Did you like the kids? And what was it that drew you to it?
It just fit with me. I loved the aspect of working with kids and but I also, what's interesting is I did a whole bunch of perio when I was there, and I did a bunch of surgeries, and they gave me a perio award when I graduated. Everybody thought I was going to be a periodontist, and I hated it. Yeah. I was like, I don't want to be a periodontist. Yeah. But anyway, so I come out of there, I go and I do an AEGD, which is, a 1-year intensive thing to become a dentist in the military. You take 3 months of different sections, perio, pros, oral surgery, all that kind of stuff, so that when they take you out of that program, they can put you anywhere in the world, because they don't have a chance to put specialists in all the different places. So you're supposed to go out and be pretty much the guy that does everything. And my first assignment out of that was Germany, and it was a 3-year tour over there. And when I got there, they had oral surgeons, but the oral surgeons were super busy doing all of the trauma stuff out of Operation Joint Endeavor, which is out of Bosnia. People don't even remember that armed conflict that we were in. But anyway, when I got there, I told them, hey, I'd be interested in taking care of all of your oral surgery stuff. And so I was trying to take out wisdom teeth with a slow speed handpiece. And I walked down to him and I said, hey, I don't have the right tools to do this. I says, I'll take out all your wisdom teeth if you want me to. A half an hour later, they had a $30,000 Stryker handpiece in my office. And so I was taking out wisdom teeth, doing biopsies and all this kind of stuff. And my commander let me go to an orthodontist one day a month while I was there in Germany. And my wife when I would come home on the days that I did ortho, she looked at me and she goes, you've been doing ortho today. And I was like, yeah. She goes, you got to become an orthodontist. She says, you're so much more pleasant to be around than when you're being a neurosurgeon.
Interesting. Yeah, our wives, they know. They have that sixth sense, that intuition. Isn't that funny?
Yeah. So anyway, I applied to ortho school while I was in the Army, and I was just planning on getting out. And the Army found out about it. And they said, hey, you want to be an orthodontist, we'll pay for it. Wow. You just have to give us a couple more years. So I ended up doing 8 years. When I got out of ortho school, when I got out of orthodontic school, I went to Fort Bragg, and I actually became an instructor for what's called the Bravo program. And so I taught orthodontics for 2 years there. Interesting thing there is they had an oral surgery program at Fort Bragg, and they needed a lot of people that needed jaw surgery. Okay. And so I set up 200 jaw surgery cases in 2 years that I was there.
Wow, that's phenomenal.
And so I got all this great experience on getting people ready for jaw surgery. And, I actually got in trouble when I was in the military, because when I went to Fort Bragg, in the first year, I started 400 cases. And I got called in and reprimanded by the commander. And he says, most orthodontists come here and do 50 cases a year, and they just have one assistant. And you just spent the whole Dentac budget, and we don't have any money left. He says, you spent it all in brackets and wires and everything. And so I found out that they really didn't want me to do ortho. They just needed somebody there to say they had the program. Yep. And so anyway, I was like, okay. So at 8 years, I got out and came to Lewiston, Idaho. I researched a bunch of places, and there was 2 old orthodontists here, and I planned on buying one of the guys' practices. And when I came, we totally intended on purchasing his practice. And after 2 or 3 days, he just said, I've decided I don't want to sell my practice to you. And I said, well, I'm going to come here anyway. And so I did the thing that nobody does, is I just found a building, and I bought some old equipment, and I put the equipment in there, and I brought one of my assistants from the military with me. I paid for her to come out so that I had somebody to work with. And our first patient was a Medicaid patient, and I was super excited to have somebody. And so here I am. I've now been in Lewiston for 25 years. Wow. And when I first started out, I had this little practice that was 2,000 square feet. We had 4 chairs. Within a year and a half, my practice had grown to where it's like, man, I've got to do something. I got to find another building. I've got to go do something else. And so my landlord that I was renting from, I told him, I says, I got to go find another place. He says, well, I'll just build onto what you've got. And so they added 4,500 square feet. Wow. And so I have a 6,500 square foot office.
Wow, that's phenomenal.
And as soon as I started building that, the other orthodontist that was older in town came to me, and he says, my practice pretty much died since you came to town. He says, would you be interested in my patients? And so he brought his patients in with me, and he said, we'll just do a 6-month transition. At 6 months, he and I got along so good. I was just like, can you stay? I said, I really enjoy. He was a great mentor. And I was doing all of the traditional orthodontic stuff. I'd been taught to take out 4 bicuspids and just make it straight. Yep. And I was taking out teeth like crazy. I was, doing all of the jaw surgery stuff I could. And, I thought that was the right thing.
Yeah.
The thing that I got nervous about is I had an adult patient that, I took out 4 teeth, and by the time I got done retracting and pulling those teeth in, her roots were basically gone on all of her incisors. I told her, I said, we don't have much of this. We put a bonded retainer on, and I hope these guys are going to last. And, and I never saw her again. And I heard years later that she had actually lost all of those teeth and had implants placed. Wow. And I was like, God, there's got to be another way than doing this extraction stuff. And my mentor, Dr. Bornholt, that was with me, he was a guy that just didn't think you needed to pull teeth. And
really?
He did a lot.
Interesting.
He was an old guy, but he did a lot of arch wire expansion.
Wow, that's great. Yeah.
And so he had all these really square, he bent his wires so his arches were really square.
Yeah.
And, but so as I was doing these, as I was treating these kids, it was interesting because I noticed that the kids, the only time you ever expanded a kid was when they had a crossbite.
Yep, of course. That's what we learned. Yeah.
You just, if they didn't have a crossbite, you took out teeth, and you took out upper first, lower seconds to get the class 1 bite. Mm-hmm. And, I think I was a good orthodontist. I made really good smiles and everything. Mm-hmm. But what happened is the kids that I expanded, the parents would come back to me. And they would say, hey, you did that expander. My kid, they used to snore and they don't snore. And I was like, yeah, okay, that's cool. But then when I was treating them, I thought, man, I sure like these expanded cases better than I like the extraction cases. Mm-hmm. And so I started looking at it and saying, well, what if I expand this kid that doesn't have a crossbite just because I don't want to take out teeth? And it wasn't any airway thing. It was just, man, I did not like doing the extractions.
You and I haven't spoken about this, Bret. I'm going to let you finish. It is insane, the parallels between you and I. So I'll let you keep finishing. But yeah, I'm making notes over here because it's crazy. But please go ahead.
Yeah. So anyway, I started doing more expansion, and it's like the stories of the moms and dads.
Yeah.
They just started coming to me and said, wow, my kid is doing better in school. And some of these parents are like, hey, since you did that expander, just in a month, my kid quit bedwetting.
Yes.
And I was like, man, there's got to be something to this. And so probably about 18 years ago, I quit extracting teeth. And I just started to be the expansion guy. And I was like, I can expand these kids. They're easy to expand. Yep. And when I do, I've got plenty of room for the teeth. And, the stories and everything that were coming to me were just, constantly on a daily basis. And it's like, there is something about this. Yep. And about the same time that this stuff happened, my dad, we had just remodeled our house, and we were in a house, the house that we're in now. And my dad, I knew it just all the time I was growing up, my dad always took a nap in the middle of the day. And so I go in there and I sit down and I look at my dad, and I'm watching him. And he's laying there on the couch, and he's just struggling to breathe every single breath. He's laying there, and it's like he's going. And I'm looking at him going, okay, I've heard of this stuff. I don't know what it is, but that's got to be that sleep apnea thing. Mm-hmm. And I'm just watching him struggle every single breath. And so I wake him up, and I said, Dad, I'm afraid you're going to die. And I take him down to my office, and I said, I want to go and make you an appliance. I've heard of this thing where they take and hold your bottom jaw forward, and it's supposed to keep your tongue out of the back of your throat. And so I went down, took him to my office, took impressions. We spent like 6 hours in my lab, and all I'm doing is playing with acrylic, building these ramps and everything like that. And I give him this just ugly looking piece of acrylic. And he goes home and he puts it in. He says, wow, that's the best sleep I've ever got.
Wow.
And so I was like, there's got to be something to this. Mm-hmm. And like the next week, somebody comes in and said, hey, do you know how to treat sleep apnea?
Isn't it funny how that happens? Isn't that unreal?
And I'm looking at this person. I remember that person. His wife is a veterinarian. She's one who takes care of all the animals.
A little irony there.
And, I look at him and I'm going, I am not your guy. I said, but I made this thing for my dad. I'll make it for you and let me know if it works. And he says, well, what does it cost? And I said, tell you what, I don't know, $400. And he goes, done. And anyway, so I make this for him, and he comes back and he says, man, he says, I'm sleeping so good. Can I tell my friend? And he told a friend, and that friend came in. All of a sudden, that friend told a friend, and pretty soon there's all these people coming to me, and they're thinking that I'm the sleep apnea guy. And I'm like, I am not the sleep apnea guy. And anyway, kind of fast forward to where I'm seeing like 4 or 5 new patients a month that I'm making this appliance for, giving them away for $400 because I'm just, it's like I told them, I'm just guessing on this. I don't know what I'm doing. 2012 comes along, and probably one of the worst years of my life. And we take one of my daughters to college, and we take 4-wheelers with us to go down to play on the sand dunes near Rexburg, Idaho, a place called the Dunes in St. Anthony. And my son dies in a 4-wheeler accident.
Oh, geez, I'm sorry.
And my life just, I went into depression. I couldn't go outside, take care of my animals, anything. And 3 months after, he died, I was like, dude, you got to pull yourself out of this. You're just going down this spiraling, hole. And so I thought, I'm going to start working out. I had gained a bunch of weight. I was, just in depression. And so I'm like, I'm going to get in shape. So I start working out, and I'm working out this one morning, and I just run out of breath all of a sudden. And I'm like, man, I just can't catch my breath. So I stop my workout, and I go upstairs. I'm going to get ready for work. I go into my bedroom, and my wife is instantly awake. She goes, what's going on? And I said, I can't catch my breath. And then my whole body started to tingle. And I mean, usually it's like when you're having a heart attack, it's your left side. But my whole body was like, it's like the whole body went numb. And I dropped, and I said, I'm having a heart attack. And my daughter, who was, I think, a junior in high school, she comes in, my wife's panicking. She instantly is on call with 911. And my daughter's sitting there, and I can tell I'm going to go. And I tell her, I said, when I go out, I said, you've got to do 30 compressions and 2 breaths. I mean, I remember all the CPRs. And I said, because I'm not going to be able to keep myself alive. I said, I'm having a heart attack. And it's interesting. My wife calls 911, and the dispatch gets a hold of the ambulance. They're in my house in 7 minutes.
Wow.
And when they show up, and I found out later when I talked to the EMTs and that, they said we were actually coming back to the station, and they didn't. When they got the call, they said, there's a guy that's having a heart attack. His name is Bret Christensen, one of the EMTs I was treating as kid. He goes, I know where he lives.
Come on.
They didn't have an address. And so they were there 7 minutes in my house, cutting my clothes off, and they just got the 12 lead monitor. They put it on there, and I remember kind of out of the back of my mind, this guy on the phone, the guy's crashing, get ready, we're coming.
Now take your time.
And I remember him taking me down the stairs and on the gurney and stuff like that, and I was in and out.
Sure.
And then I remember when I got to the emergency room, I remember one of the nurses was one of my patients that I had seen that week, and she was mad at me because I didn't take her braces off. And everybody told me afterward, they said, you came in and all you were doing was trying to apologize to this lady as you're having a heart attack because you didn't take her braces off.
Wow.
And then everything went black.
Wow.
And I thought I'd died. And I woke up, I think 3 days later in ICU.
Whoa.
And I'd had a heart attack. And what's interesting is I'm here, totally by God's graces.
Yeah.
The hospital, we're in a rural area. And 6 months before my heart attack, the hospital just got a catheter system there where they could go into the heart. And so the cardiologist there, within 40 minutes of the phone call, he was inside of my heart pulling out a 2-inch clot.
Wow.
And putting a stent in. And when I came out of that, woke up in the ICU, they told me that 60% of my heart was damaged and that I might not ever recover from this. And, and so when I finally got home, man, for me to get up and walk 10 feet was, I did that and I was done for the whole day. My heart was damaged so much. And I missed, I don't think it was like a month or two of work. And when I went back, Dr. Vornholt came back into my practice, took over my practice, and he ran it for probably about 6 months or so, and with me kind of being there as a decoration. Mm-hmm. But it was kind of a cool opportunity getting back to the airway, how this all comes into play. While I'm sitting there recovering, I'm thinking, God, everybody thinks I know how to deal with sleep apnea. And interesting note about me, when I first moved to Lewiston, in the first year, my wife sent me to the hospital. And she says, you keep waking up and gasping for air every night and scaring me. And so she says, I think you have that sleep apnea thing. And I went to the hospital and had a sleep study, and they said, yeah, you have sleep apnea and you're obese. I was 230 pounds.
Wow.
And they said, you're obese. And man, that didn't feel good. I didn't like to be told I was obese. Yeah. And so
I picture you like that. You're so fit now. It's great. It's amazing. Yeah.
But anyway, looking back, I look at, this heart attack, and I look at everything, the comorbidities of sleep apnea is stroke and heart attack. Yeah. I was 45 years old and I have the widowmaker heart attack and I almost die. And so, even today when I'm treating patients, it's personal. Yeah. Like I tell these people that come in at 40, 42 years old, this is not something you play around with. I'm living proof that, this stuff hurts you. Yeah. And anyway, so I'm recovering from, this heart attack. And I told my wife, I said, we've got to go get some training on this sleep apnea stuff. And so we find Sleep Group Solutions is having a training over in Seattle. I remember my wife was on my arm, kind of helping me stabilize as I go to this meeting. Wow. And I think it was about 2 months after I had the heart attack. And I'm in this meeting and they're talking about sleep apnea and they're training you and everything. And they have this machine there it's called an echovision rhinometer and pharyngometer. And they spend a lot of time on the pharyngometer and it measures the airway in the back of your throat. And it's used to position the bottom jaw forward so that you can find out where to make your mandibular advancing device. And they said it's the best way to actually accurately know exactly where to place the mandible. And I'm like, yeah, this is what I need. And while they're doing this, they're saying, now there's this other aspect of this machine that's called the rhinometer. And it's just there to tell you how big the nasal airway is and tell you when to refer to an ENT. And as I'm watching them do this, my brain is going 100 miles an hour and I'm going, this measures size. And I'm thinking about all these kids that I have ever treated that are, the parents are telling me they quit snoring and everything. I said, and so I raised my hand. I'm the only orthodontist in this big group of dentists that are learning about sleep apnea. And I said, can you use this machine on kids? And John Nadio, I think is his name, with Sleep Group Solutions, he blew me off. I mean, he was like, this is for you to know when to send him to the ENT. I says, but does it measure size? Does it matter if it's an adult or a kid? And he says, well, yeah. He says, but, this is just to tell you when to send somebody to an ENT so they can have their nose rotorated. And anyway, it was a 2-day course. I took the sleep apnea test that night, and I still had sleep apnea. And anyway, we go back the next day and we're like, we've got to buy this thing. And I'm going to go home and start recording all of these kids that I'm treating and seeing what happens to them when I expand them. And so from 2013 till today, I have tested every single patient that walks through my door. Wow. And we have data of thousands of patients that we have before treatment and after treatment rhinometer readings. I kept that data, and I just knew I had to keep the data.
Yeah.
I'm not a statistician. I don't know how to crunch numbers. And I had that data for probably 10 years. And one of my patients, I'm treating all of his kids with this, and I'm showing him how we're taking his kids from little 2 and 3-year-old airways up to adult airways with expansion. We're getting 1, 2, 3 cubic centimeter volume changes with them. And he says, I'm on a machine. And he says, what about me? And so anyway, I'm treating him and we're measuring him. And he says, I want your data. He said, let me take your data and let me crunch the numbers and tell you what your data says with these kids. And so anyway, we give him the data. And he says, you guys are horrible at getting your data, accurately at different times. And he says, after I looked at your stuff, some kids you got data, before, but you didn't get it after or get it at the right time. And he says, you have clean data on 347 patients. I was like, well, that's not very good. I have thousands, but you didn't do it at the right timing. Kind of doing it sporadically. And anyway, he comes back with the data on this, and he says, and this guy's all about sports, and he says, you know who Spud Webb is? And I said, yeah. He says, it's like you just took Spud Webb and turned him into Kareem Abdul-Jabbar. I remember that conversation. He says, you just totally, like 3 times, these kids' airways. He says, this is really important data. And so, the Sleep Group Solutions, I told them, I said, hey, I've got data on your rhinometer, and I have this data, and I said, I'd like to tell the world about it. And they said, well, we do these webinar things. Let's get you on there and let's have you show the data on this. And so I remember doing the webinar, and I'm thinking, man, there's probably like 10 people watching this. There's probably nobody that even cares. But I was excited about it because I'm sitting there showing them, and like, yeah, so we took these people, our minimum cross-section area increased 1 to 2 millimeters, our volume. We had kids that were getting 5, 6 cubic centimeters, but the average was like 2 to 3 cubic centimeters. And
cubic centimeters, like a die, right?
Yeah, a dice is a cubic centimeter. And so if I'm increasing the nasal volume by 3 cubic centimeters, that's like shoving 3 dice up your nostril. And so anyway, I do this webinar with them, and I'm not thinking anything's important with it, but I wanted it to be important. And then I was going to go to another course that weekend. I'm getting on the plane, and while I'm getting on the plane, my phone goes off with a number, and I was like, I normally don't answer the phone if it's somebody that I don't know. And anyway, I answer it, and there's this guy on the other line. He says, hey, my name's Kevin Boyd.
Kev, awesome.
And I'm going, okay. And he goes, do you know who I am? I said, no, I have a clue who you are. And he says, you presented data and I saw it. He says, you need to be part of what we're doing. And I said, part of what? He says, we are a group of airway doctors and nobody has the data you have. And he says, we need you to be part of us. And so
I can hear Kev saying that. That's great.
And so anyway, I was like, well, they just closed the doors of the plane. I said, I'll have to get back to you. And I just really didn't even understand the impact of that phone call. And anyway, so a few days go by and he gets a hold of me and he says, Bret, he says, we need your data in what we're doing. And so that was the introduction to Ben Moralia and Lauren Gates and the whole Airway Health Solutions. And they brought me on and they said, you've got to share this with the world. And so here I am, now I'm and I know that my stuff works, and I'm not one of those polished speakers that, gets out there and I'm just a farm kid from Idaho. I became an orthodontist. And I found out that keeping data is my go-to. Now on the adult side of things, when we look at that, I was making these mandibular advancing appliances for probably 15 years. And, we're having good results. And I'm recording every single one of those mandibular appliances. And we're not really getting any airway changes by holding the mandible forward. And so in 2018, a dentist in our town, he says, I know that everybody's coming to you for this. He says, you need to go to this course in Las Vegas. And so anyway, we both go to this course in Las Vegas, and it was David Singh talking about doing Schwartz appliances. They called it the DNA appliance. And so I was like, okay, no, you can't grow adults, because we were told in school you can't grow adult jaws. Right. And yet I saw these cases that he was presenting, and they were using this Schwartz appliance, and it was taking me a year or two to expand adults, and I'm going, that's crazy. So I jumped on the whole Vivos thing, and I said, all right. They contacted me, hey, $50,000, $60,000, come to our course, and we're going to, change your life. And I go to the Vivos course, and this is in, I think, 2018. And I come back, and I'm like, all right, I'm all in. And I expanded myself. I spent a year and a half wearing the Schwartz appliance to expand myself. I expanded myself like 8-9 millimeters. And I started breathing better. I started sleeping better. And I'm looking at this, and all the dentists around me, and even the orthodontists, are thinking that I'm out on the fringe. Yep. And they're like, you can't do this. You're going to push those teeth out of bone. Yep. And, you don't have any validity to this. What you're doing is malpractice. But my patients were coming in and telling me, man, I am sleeping better than I've ever slept in my life. Yeah. And so here I am. I'm like doing all these things. I remember a dentist that he brought his wife to me, and we're doing the Schwartz appliance. She had sleep apnea, and she ended up getting recession like on a lower incisor. And like in a couple of months, she had recession on a lower incisor. But they had moved to Arizona, and he came back, and he was ready to go to battle with me. He was ready to sue me over me doing this. And, and I was like, God, if I did this, if I caused this, then it's my fault, and I'll have to pay for it. And that's just, how I am. If I did something wrong, I'll own it. And I said, let's get a CT scan, and let's look at where that tooth is. And we did it. We overlaid the CT scans. That tooth hadn't moved. She just got recession like some people. And I asked the guy, he is a dentist for 40 years. I said, have you ever had a patient that didn't have recession, and they come back a couple months later and they have recession? He says, yeah. He goes, this is my wife. He says, I was ready to take you to court. He says, you proved to me that you didn't actually push that tooth anywhere. But it's one of those things that you worry about. You don't want to do something wrong. Yep. And so, I'm going and I'm expanding these people. I'm taking people from 60 plus AHIs down to like 10. I remember having this one patient that I was working with, his sleep physician, and it's a guy that I met on a plane going to a course, and I told him what I was doing, and he shows up in my office the next week, and he says, I've got sleep apnea, and he says, I'll be your best patient. And he's still a great friend to this day. He expanded himself like probably 8 millimeters. And we helped his sleep apnea go from severe down to mild. And so I called his sleep physician, and I asked him, I said, all right, I got this guy from like 63 apneas an hour. I've got him down to like 8 or 9. And I said, how do I get rid of these other apneas? He goes, you did what? He says, I said, well, I've got him to here. I said, but how do I get rid of these other ones? I said, I've done everything I know how to do. And he says, you got somebody from severe to mild, and they're not wearing a CPAP. And, he says, be happy. And I'm like, yeah, but that's not me. I says, we're dentists. We fix things. He says, yeah, you guys think you can fix everything. Golly, he says, you improve that guy's quality of life so much. He says, be happy with it. And, to this day, the guy is still a really good friend. He just thinks we walk on water. But anyway, so I'm doing this. And so I'm the data guy, and I'm seeing similar type of expansion with the Schwartz and the nasal volume stuff. We're seeing 1 to 2, sometimes 3 cubic centimeters. And I'm thinking that's pretty amazing. But we're still having people going from severe and they're like still at the mild. I have a few patients, their sleep apnea completely goes away. But most people were just improving their lives. And, we're going along and I start watching the MARPE stuff. And I said, well, we're doing this. And so I said, I wonder about the MARPE. So I went back and I start gathering the data. I'm looking at the before and after the intraoral scans. After I had expanded them, we put them into braces because when you expand them with the Schwartz, their bite is completely screwed up. Got gaps everywhere. So I put them into braces and I fixed their bite. Amazingly enough, those teeth come into place super fast after you've expanded them. I mean, we're getting people done in 6 months.
Because you have space. It's
everything just jumps right into place.
Yep.
And when I get done, I'm like, okay, I expanded this guy or this lady 8 or 9 millimeters. And when we're done, we get 5 millimeters, 4 millimeters, 3 millimeters of growth. So there is a dental tipping, a big dental tipping part of this. But there's also some remodeling of the maxilla and tongue space. And we are definitely helping these people. And, my brain is like, is there a better way to do this where I don't have to do all that tipping stuff? And I've been following the MARPE movement, but man, I'll tell you what, the first ones where they were doing the MSEs with the out-of-the-box expanders right down the line, and the arms on those things were weak, and they were bending, and the implants are walking around in the bone. It's like, man, I'm going to sit back and watch this for a little while. I don't want to be the first guy out there. I don't want to be doing stuff unless it's really going to work. And finally, I'm watching this stuff and like, okay, 3D printing comes in. We can 3D print. We can accurately know where those mini implants are. We know where the length of them. We can get bicortical engagement. It's a rigid appliance. And Dr. Ting in California, he says, hey, I have now done 1,000 of these. And the course that I give is what not to do. For me, that was the selling point to go see him. And not, hey, come, this thing works on everybody. I'm wonderful. Learn what not to do. And so anyway, we go to Dr. Ting's course and we come back. And most people that go to a course, they go to a course and then they go back and they think about it forever. And they're just like, yeah, that's a lot to do. I don't know if I'm going to step out there. I'm the kind of person that's like, if this looks like the best treatment, I'm all in. I go $60,000 on implants and piezo machines, and I'm getting everything and getting it set up. And our first patient, it takes me 2 hours to put a MARPE in. We're taking a CT scan in between, like all the things, making sure that I'm not screwing up, and them, I'm afraid to do the expansion. I'm afraid to pop the tissue in the palate, and just nervous about everything. The good thing is Dr. Ting's course gave you all the things of what not to do, and be slow and don't go fast. And so now I'm starting to do these, and my first 2 patients, they tell a couple people, and then they tell a couple people. And, we thought, we'll probably do 1 or 2 cases a month. 2025, we did 100.
Wow.
And it was like, and it's all word of mouth. It's like, and a lot of my Schwartz patients that I was treating, I've got a guy named Kevin. He's a concrete guy. He actually poured a big concrete slab in my barn for me. And he was a Schwartz appliance patient, 2 years. And he says, I just can't wear this thing during the day. He says, if I wear it during the day, I can't talk. I'm talking to my kid all the time. He says, and I don't want to feel like an idiot. But he says, I love the mandibular advancing part of it. He says, but I can't breathe any better, by wearing this. And so a lot of my Schwartz patients, I'm like, hey, we're trying this new thing. It's, questionable, I can't tell you if it's going to work great, but the theory behind it is that we're going to actually skeletally grow your jaw and open up your airway. And we're going to have to cut your palate with this piezo. And, we want to go slow with this. And Kevin's one of my favorite stories because this guy, probably about 4 months into his MARPE, he's turning this thing like every 3 days. And we're pretty good friends. And he sends me a text. He's always wearing his little Fitbit watch or whatever. He measures everything. He measures his sleep. And he sends me a text this one morning. He says, my wife woke me up 3 times last night. She thought I'd died.
Make sure he was alive. Yeah. Yep.
Yeah. I said, what do you mean? He says, I wasn't snoring. I was so quiet.
Yeah.
He said, she had been, he's got, I'm treating his grandkids.
Wow.
And I think he's 64 years old now. And he says, my Fitbit says my sleep is at 99%.
Wow.
And so we do a sleep study. Sure enough. This guy was one of the severe sleep apnea, and he was like 40 some odd episodes an hour.
Wow. And
he's down to none.
Yeah.
And so going back to our rhinometer, because, I'm the data guy, here I'm measuring everybody, and I'm seeing on average 3, 4, 5 cubic centimeter changes in the nasal volume. And some people 7, 8 cubic centimeter changes in the nasal volume. And another one of my super favorite guys, I saw this guy, probably 7 or 8 years ago. And he had a super, super small upper jaw, deficient lower jaw. And when he came in 7 or 8 years ago, I said, you're a double jaw surgery. I said, they're going to have to do a SARPE, expand your maxilla, and we're going to have to do this. You're going to have a mandibular advancement. He disappeared. I think I scared him away. I said, you're having a double jaw surgery, to try and correct, just to get your teeth to fit together. And anyway, he shows up while I'm doing the MARPE. And I said, we can do something different. And so anyway, I show him the MARPE, and he says, I've been saving up for 7 years.
Wow.
So I can do what you told me to do.
For the surgery.
I thought that he had just scared him away. He said, I've been saving up. I have like $30,000, $40,000 ready to go do this. And so I'm like, well, let's do the MARPE. His palatal width was 23 millimeters between his 6-year molars. And so we do a MARPE, and we get these amazing nasal volume changes with him. And he's now at 44 millimeter
Oh my
palatal.
gosh. Wow.
And this guy's going around and telling everybody, he says, I can breathe like I've never breathed before.
Wow.
And so now we're in the stage where we're uprighting the bottom teeth, and we're getting him ready for the mandibular advancement, because he's still going to have the mandibular advancement surgery. But to be able to take somebody and expand them that much, was just, amazing. And we're seeing people, it's pretty easy to get 8 millimeters of expansion. I've got people we've gotten 12 millimeters. And so, the patients that I'm seeing now, I don't promise them the world. I tell the patients, this is what happened with my other patients. Some people are like, can you guarantee you're going to get rid of my sleep apnea? And I said, there's no guarantees on anybody. Everybody's different. Everybody's a piece of biology. But I said, all these different patients are having these amazing changes. And here's my thoughts on sleep apnea. Everybody focuses on the tongue. Everybody says sleep apnea is your tongue's going back there and blocking the airway. Nobody looks at the nasal passage. At least they haven't until lately.
Yep.
Everybody's saying, okay, we need to do a CPAP, pressurize the system so the tongue doesn't block the airway. Or we need to hold the lower jaw forward, so the tongue doesn't block the airway. Nobody looks at the nasal passage. And what I have found, and I think the key to this, is when we do skeletal expansion, and I hope I never do Schwartz again, because of now what I'm seeing what I'm doing with the MARPEs. But when you expand that maxilla and the nasal passage opens up and that pathway of airflow is just smooth, what happens is that patient can now breathe through their nose, and if their tongue is sitting up and forward in their palate, then they have a seal and they've got a free-flowing passage of air.
Yep.
And so when they do that and they don't have an oxygen desaturation and their oxygen drops and then they have to open their mouth, that's where we really see the sleep apnea dissipate. It's when we can't breathe through our nose. Agreed. And then soon our sympathetic nervous system is kicking in, and it's pretty soon, as soon as we break that seal, we open our mouth to take a breath, the tongue drops into the back of the throat and you've got an apnea.
Yep.
And so the key to sleep apnea is not worrying as much about the tongue. It's worrying about getting that nasal passage opened.
Yep.
Now, you can't disregard the tongue, because guess what? Huge population of the sleep apnea patients are tongue-tied. Mm-hmm. The reason they have an underdeveloped jaw and they've got these small nasal airways is because their tongue was non-functional as a child.
Yep.
And so, every single one of my patients, when I get them out of an expander, is going to a myofunctional therapist, mm-hmm. because they've got a less than functional tongue. Mm-hmm. Working with a myofunctional therapist, if they need a tongue tie, I'm happy to release those and have them continue to work with them. That's where we see the next step of real big improvements, is now we get that tongue functioning mm-hmm. correctly. And we've got an open nasal passage front to back, and that's where we're really seeing the big differences. My myofunctional therapist is amazing. I have 2 or 3 of them that I work with throughout the country with virtual appointments. Okay. You don't have in your neighborhood. So we're having amazing results. And a year or so ago, well, let's go back to health history stuff. After the heart attack and everything, for me to come out of my slump, and they told me my heart was 60% damaged and I'd never be able to do much. Mm-hmm. What I did is I was like, okay, my wife and I, let's go walking. And so it took me forever to get up to where I could even walk a mile. Wow. And after, getting so that she and I could walk a mile, I said, hey, let's try a little bit of jogging. And so we'd jog a little bit. And it took me over a year to be able to jog a mile. Wow. After my heart attack. But I got to where it's like, man, I'm feeling better by doing this. Mm-hmm. And so I started running. And I've always liked bikes. And I thought, okay, let's do bikes. And so I liked biking better because it wasn't so jarring. Mm-hmm. And I remember I got back into shape, and I was out doing 20, 30 mile bike rides and running 2 or 3 miles. And I remember being at a state fair, and I was like, there's something else that I need to do. And I said, I'd like to do that thing they call triathlon. And so I'm at this fair, and I go up to this guy that's the swim coach for the high school. And I said, hey, do you guys ever, have stuff for adults? And I says, I want to do triathlons. And I said, I know how to swim. I said, I'm a really good swimmer. And I said, but I just need a little bit of, pointers and stuff like that. And he says, yeah. He says, I have this thing called Masters. It's a bunch of old people that get together every Monday, Wednesday, Friday at 5:30 in the morning. We swim for an hour. And he says, come and join us. So I said, sure, I'll come and join you. I show up with like board shorts, and he says, all right, jump in the water. You're going to love this story. He says, jump in the water and swim across the pool. And so no problem. So I jump in the water and I swim across the pool. And I get done, I'm smiling. He says, now put your head in the water. And I was like, hey. Put your head in the water. He says, and every time you're doing this, he says, lift your head and breathe. And I couldn't even make it across the pool. Wow. And years later, after I had learned how to swim and done all this stuff, one of my really good friends that I did triathlons with, he says, we have this triathlon group was in the pool the same day you were there, your first day you swam. And he says, the lifeguard got off the thing and came running with the buoy. They thought you were drowning.
Oh my gosh. That's hysterical.
And so anyway, I did my first triathlon, little sprint triathlon, and I was hooked. Yeah. And so now I'm looking for all these triathlons. And I actually ended up doing an Ironman up in Coeur d'Alene, did a half Ironman. I came back from that one, and I'm like, come to this triathlon group and they say, hey dudes, I'm an Ironman. They said, no, you're a half Ironman. Half Ironman. No, I said, I did an Ironman. I said, no, you did a half. You don't get to count yourself as an Ironman unless you do a full. And so I trained for another year or so, and I go do a full Ironman down in Tempe, Arizona. And I'm feeling like $1 million, man. I feel like I'm totally overcome my heart problem and everything. And then in 2023, I'm out on a 75-mile bike ride by myself. I do that all the time. I'm coming into town, and this car hits me. Oh my gosh. On the bike. And I got hit, and I woke up, and there's all these people standing around me, and my brain is like, oh, I got to get home. So I get up, and I'm hurting everywhere. And I'm like, oh, I'm good. I'll be fine. And I was like, I'm just going to grab my bike and I'm ride home. And I grab my bike, and my bike is a taco. I mean, it folded in half. And so anyway, the ambulance comes and they're wanting to take me. I said, no, I'm fine. You know, in my brain, I'm always just like, I'm fine. And anyway, they take me to the fire station. I said, don't take me to the hospital. I should have gone to the hospital. But anyway, my wife comes and gets me, and I just don't ever feel good, ever again. And 6 months later, I'm like, okay, I need to go and get my shoulder fixed because my shoulder was damaged in the bike accident. My brother's an orthopedic surgeon. I'm on my way to go get my shoulder fixed. And he goes, hey, the anesthesiologist was not going to treat you unless you get a cardiac clearance because you had a heart attack. And find a cardiologist. My brother is like 10 hours away. Find a cardiologist in Boise. He says, yeah, I'll look at you. And it was interesting. I go in there, and they do the ultrasound. They're going to just check my heart. The lady that does the ultrasound is sitting there looking at the ultrasound for about 30 seconds, gets up, walks out. And I'm going, what's going on? When she get up, the cardiologist comes in, looks at it, he says, you're not having shoulder surgery. He says, you're in heart failure.
No way.
How's that feeling? And I said, you know, I just don't feel like I got the energy. I can't bike anymore. I can't even do the trainer. He says, your aortic valve is sitting there flopping around. He says, it's not doing its job. He says, I think your aortic valve is torn. He says, did you have any traumatic experiences in the last, while? I said, yeah, I got hit by a car. And so anyway, here I am, rushing in to get open heart surgery, and then put a pig valve in my heart so that I can, function. And even since then, that was back in 2023, I'm like, okay, get back on the bike, man. You got a valve, it's working. Even after that, every time I go and they say you're still in heart failure, you have an ejection fraction of 35%. Normal is 70%, so my heart is functioning at 50%. And here, just a few months ago, they checked everything. My ventricles are wobbling. They're not communicating. They're not functioning correctly. And so the blood is just pooling in my heart. And so here a month and a half ago, I get a pacemaker. And now my heart's pumping normally. This morning, I got up, did a 40-minute bike. I'm not out of breath. And I'm going to go back. I'm going to do another Ironman. Yeah, you are. It's going to, I'm going to train myself here and get back to it. I bring all the heart stuff in here because what's the number one thing with sleep apnea? Yeah. What I have is since I was a little kid. Yeah. I had a underdeveloped jaw. I had a heart attack at 45 years old. That heart attack led me down this whole pathway of 4 different heart surgeries. And, when I have a patient that walks in and like, oh yeah, they say I stop breathing. I said, this isn't something to play around with. We need to, you need to take this seriously. Don't be me. Yeah. Yeah. And so, wow. Anyway.
Wow. I don't even know where to begin to encapsulate that. And there's some other things I want to hit on as well in the episode that we'll get to. I want to take a moment though, just to revisit some of that and try to, the best I can, encapsulate some of your journey. And as my audience, people listening to the show probably know, it's not hard for me to talk. I tend to be a talker sometimes on the show. I think I'm doing it a little too much. I really just enjoyed just sitting there and listening to you. And I know the people listening did as well. I can't thank you enough for your honesty, for pouring out your story, especially as it relates to your own health and the loss of your son. I would be remiss if I did not say that you have an amazing family, huge, beautiful. How many kids, grandkids? I mean,
we got 12 grandkids and 1 on the way.
Oh my gosh. And how many kids?
We had six kids. Okay. We have 4 of them left. We lost our son Hunter at 13. We also lost a baby at birth. Okay. But we count them. We still have 6 kids.
Absolutely. Yeah. I mean, it's absolutely amazing. You are a testament to resilience, drive. Thank you for your service as well in your time in the 90s that you put in the service for our country. I couldn't help but be struck as I was listening to you speak, Bret, by you clearly exemplify my belief and the belief of many of us that we're here for a reason.
Mm-hmm.
And I'm not just saying that to be cliche or hyperbolic. I mean it. We are here for a reason. Your journey is remarkable. I mean, we knew each other casually. We've seen each other at meetings. We've spoken together at the Area Palooza last fall. And I didn't know your true story to this extent. And I'm a bit at a loss for words for it, because it's so profound to me that you never give up. I mean, you're 6 weeks-ish away from your last heart surgery, from having a pacemaker put in, and you're already focused on the next goal. And yet through this, instead of it getting you down, making you angry, jaded, frustrated, you have turned it around into helping change so many lives for the better. You don't have to be on this journey. You could, like you said, you were a traditionally trained orthodontist, much like myself, extracting teeth, straightening teeth, treating the symptom, not treating the etiology, making patients look better. As I say often, and as I said when I spoke at Area Palooza, that tends to be the easier way to do things for an orthodontist, right? It's the more, right? It's a more profitable way. It's the easier way. It just falls into our systems, and it's certainly the journey you have been on personally and professionally. I just want to underscore that is not easy, even as recently as within the past 5 to 7 years, engaging in the MARPE side of things. And I couldn't help again but be struck by, here you had this surgical background when you were in the service, and you're doing all these surgeries. You are uniquely equipped to be doing what you're doing kind of surgically, essentially. I mean, you're doing pizzos, you're cutting through the middle of the palate, and you're going in and putting these MARPEs in, which is intimidating for a lot of providers to do. Because of your background, you have the perio knowledge. So when you were dabbling in things like in the Schwartz and the Vivos type appliances, you understood the periodontium at a level that most of us don't. Most of us just say, oh yeah, if you tip teeth in an adult, you're going to push them out of the bone, even though the literature is very clear that you certainly can do that. But you can still get tremendous dental alveolar change and even sutural remodeling in adults if done properly and slowly over time. You had the perio knowledge, so you weren't scared that you were going to be tipping teeth out of bone, because if you did, you would know what to do about it. You knew what to watch for. So all of these life experiences that you had, and then with the loss of your son and battling through depression, which is something that's so real. And again, I'm so appreciative that you shared that, because I did done some episodes on the show with some colleagues, and Bret Gilbert, who is just an amazing guy. We talked about depression. He's an endodontist, and we talked a lot about how many of us in this field struggle with mental health issues, and it's a real thing. And it doesn't mean that it's something we have to let debilitate us or change the trajectory we're on. We can actually use it to our strength to learn our limits and learn what our true purpose is. And you did that. You picked yourself up and you said, I'm going to fight for this. And you're fighting to change the lives of patients. And you, by your data collection, by your intelligence, even by your background as a farmer. I mean, the fact that that mechanical nature, right? When you're on a farm, you have to be able to fix things. You can't just be calling somebody every time a tractor's broken down, or right. You have many responsibilities. You have to figure this stuff out. So that lets you be someone who can figure things out now in the mouth. So you're so uniquely positioned to be doing what you're doing. And I just want to acknowledge you for that I really admire who you are and what you are doing. How old are you now, if you don't mind me asking?
I am almost 59.
Okay. So coming up on 60 here, you don't have to be engaging in a whole new way of practice. It would be much easier you've got a great reputation, you be straightening teeth, making a lot of money, sail off into the sunset, right? But you are constantly pushing to be better personally and professionally. And that is the mantra of this show, is to help our colleagues live better lives, both personally and professionally. And I even have a lot of laypersons that listen that embrace that concept. So I just wanted to take a moment to just underscore that and thank you for your openness, as well as reflect on a little bit of that. I said I'd come back to the similarities between the two of us in certain things. The early part of your career, it was so interesting when you talked about the fact that here you were trained traditionally, you're out there, you're straightening teeth, you're pretty darn good at it. And I would say the same for myself. I pride myself in being a pretty darn good tooth straightener. And I went to UConn, trained in traditional biomechanics, Charlie Burstone, come out. And when you said you sat there with those young patients and were like, why am I extracting teeth on these kids? The teeth are the symptom, not the cause. I'm giving a talk soon at the Florida Association of Orthodontists, and it's part of what I'm going to be talking about is that journey I went on, that we are in complete parallel. And then I did the same exact thing. I just started saying, I was going back to UConn, and I was teaching at the residency because I built my practice from scratch as well, just like you did. And I built it up, and I had time. So I would go back to UConn and teach a couple times a month. And I would go back early or stay late because back then PubMed, you couldn't get it on the internet. You had to go to the library. So I would go to the health center library, and I'd go to PubMed, and I'd start researching about this lower expansion and can you expand in the lower arch? And I start seeing articles from the 60s by Schwartz and Gratzinger, and I start reading Ricketts in the 70s and things that maybe were glossed over in residency. And I'm not like a year or two removed from it. I'm like right after residency. So it's not like, I wouldn't be remembering it at that point. But these are articles we certainly hadn't read. And then McNamara and some of his articles on this, and realizing that tooth size is rarely do you have generalized macrodontia. You have it, but it's pretty rare. Almost always it's generalized micrognathia. And so I'm looking through all this, and I'm looking at these patients. And Bret, when the parents would come in, they would just say, I'm thinking, I see a 6-year-old, 7-year-old, and going, yeah, I guess we got to take teeth out because, as you said, they didn't have a crossbite. And I was trained that if they don't have a crossbite, you start to take teeth out because there's nothing you can do for them. Or maybe you could do a little upper expansion, but as we all know, that rarely ever works because the lower's caved in, so you're not going to get enough room. And so I just started looking at these kids, and I'm like, I guess we got to take teeth out. And they're saying, Dr. Mike, like, you're young, you're new. We thought you'd have new techniques. They've seen other orthodontists, and they all said to take teeth out. Like, are you sure there's no other way to do this? And I put my ego aside, and I said, I need to, maybe there is, and I don't know about it. And that's what I started to research. So I started putting expanders upper and lower in on these patients. Lower turned very slowly, and I started seeing this change. Well, just like you said, parents are coming in and saying to me, geez, Dr. Mike, do you think it's an accident that they stopped snoring? And Bret, I tell people all the time, I'm embarrassed looking back. But when you said it, I'm like, I can't believe he's saying this. I literally would say to them, I don't really know. I always try to be honest. I tell residents, I never lie to your patients, right? Never. You have to be careful when you're scripting on things. You don't want to alarm people, but you always have to be honest and truthful with them. So I would say to them, I really don't know. I know there's some research that like expansion makes the nasal cavity bigger, but I hadn't learned any of this. And so I'm thinking, it can't hurt. It certainly doesn't hurt. So It kept happening again and again. And then they started saying, the weirdest thing happened. Within a couple months, you put in those expanders and they stopped wetting the bed. We had the physician looking at this, and we've done this and this. Do you think there's anything there? And doing better in school and all. And again, I'm embarrassed to say, Bret, it took me years before I actually realized that I was playing a role in that. I'm thinking, I don't know, maybe it's probably coincidence. They outgrew it or whatever the things we're told. Also, then when I got to the next point, I have a personal side to my story and passion, certainly different from yours and not as profound, but I'm a chronic allergy sufferer and chronic sinus sufferer. And I've had 2 sinus surgeries. I have one of my inferior turbinates partly removed. And so I have battled this since dental school. Literally, I lived in a mold-infested apartment in Long Island, and I got, for the first time in my life, I started developing horrible issues, respiratory problems, waking up in the middle of the night short of breath. Never had asthma as a kid. Had allergies like hay fever type stuff, but never this profound. It was never life-altering. And it really became really dramatic, and it resulted in chronic nasal polyposis, and just had to get 2 major sinus surgeries early in my ortho career practicing. And so then when I started realizing, like, wait a minute, a lot of these kids have a stuffy nose too, and the parents say they're always congested. And then I got my ICAT, my low-dose ICAT in 2014, and I started to look at the nasal passageways. I was then on the cleft craniofacial team at Albany Medical Center, and I'm working with the ENTs, and they're teaching me about what you were saying, how important nasal passageway patency is. 100%. Right? And so I'm focused on, again, now I'm starting to understand airway a little bit. This is like 2014, 2015. I'm starting to kind of understand airway a little more, but I still am thinking it's about tongue volume, as you said, right? It's about tongue volume, and it's about pharyngeal airway patency, lymphoid tissue, adenoids and tonsils. And then I start talking to ENTs, and they're like, this kid can't breathe through their nose. And I'm looking at it, and I have more head CTs than I even want to think about that I've had in my life. And I start thinking about my CTs when I had pansinusitis and these obstructive turbinates. And I'm going, wait a minute. Maybe if I get these kids young, breathing through their noses and having a better quality of life and health now, some of this will be more successful when I go in and help grow them, right? Because that's the thing that's why we talk about doing like a myofunctional trainer or a guidance appliance young. I'm not opposed to them. The problem is if the patient can't breathe through their nose, you're going to have zero compliance, because when they put that thing in their mouth and you tell them breathe through your nose, they can't, and they'll suffocate. So they're going to spit it out. You have to have nasal patency, nasal passageway patency, which is why I love you collect the data you collect. So again, the parallels there were just so interesting, this journey we've been on. And you know what's so cool about this is two orthodontists here having this conversation. As you know, and I've seen a little bit probably online, I get a fair amount of hate from my orthodontic colleagues for speaking the way I speak, and you do as well. And
100%.
Yep.
An interesting little thing. I think this is important, and so I asked to speak at my Idaho State Dental Association meeting a few years ago.
Yep.
And I was going to come up and present the data, and I didn't think it was going to be a big deal. Hey, we have speakers all the time. And all of a sudden I get this kickback. The American Association of Orthodontists doesn't want you to speak at your state dental association meeting. Yep. I was like, why? And they came back and they said, only if they have somebody that can come and rebut you.
Oh my God.
I was like, what?
Was this at the dental or ortho, state ortho or state general dental?
State Dental Association.
So the dental. Okay. This again is so crazy. So in about a month, I'm going to be speaking at the Florida Association of Orthodontists meeting. And I know that it's a hostile crowd. Interestingly, I didn't even see this. I didn't know where. I've since seen the images, but a friend of mine told me, wow, they're saying some really awful things about you online. And I was like, yeah, used to it. And he's like, yeah, about you speaking at this meeting. And I'm like, what? I'm like, I haven't seen those. And vicious attacks that coming from people in the AO establishment saying that I don't deserve to be on the stage. It's the FAO, Florida Association of Orthodontists. I did speak at the Florida Dental Association last year, and a couple people in the room were a little edgy, but it was well received, and AO didn't get involved. But yeah, so I've been, again, the parallels are insane. I've been shocked that there are these people out there like literally trolling me, saying that no one should be giving me the platform to speak about. And my topic is pediatric sleep disordered breathing. Why should we care? It's talking about like helping our colleagues see everything that you just spent the last hour talking about in the journey you've been on. And I back it with data and literature and data from the medical literature. And I'm certainly not just going up there and giving anecdotes and talking about that. I talk about evidence basis and what that really is. And I want to highlight that in a second. But you know what I've learned, Bret? Always be wary of the people who try to stop the speech of others.
Mm-hmm. If somebody's that adamant against you, you're doing something right.
That's what I said to my friend. I said, who's also an orthodontist and an excellent orthodontist. I said, it just tells me I'm over the target. I said, because if I weren't, they wouldn't even know my name or care. And they would tell people, please go listen to this guy, because you're going to realize how out of bounds and off the wall he is. And you're going to know that everything he's saying is incorrect. The reason they didn't want you to speak and the reason they don't want me to speak is they don't want to hear it. And the old, you can't handle the truth. They know what's coming.
Yeah, I look at this, and what's interesting is my presentation was about airways. And it was just about, nasal breathing and all of this kind of stuff.
Yep.
And it's interesting. The guy that they sent is actually an orthodontist in my town that is totally against me. He's gone around and pretty much turned my local dental community and said, this guy doesn't know what he's talking about. And he goes, I'm board certified in tooth moving from the AAO. He says he's board certified in sleep medicine, which I am through the American Sleep and Breathing Academy. Mm-hmm. And what's interesting is that when they came in to rebut me, it was...
Yeah, what was that like?
Well, his thing was orthodontics doesn't change sleep apnea. I didn't say sleep apnea about a child once in my lecture.
You. That's where they have it. That's how you know they don't know what they're talking about. And once they go right to OSA, you know that they don't know what they're talking about.
Yeah. It's like, okay, so when you look at sleep apnea and airway stuff, upper airway resistance syndrome is in pretty much almost all of the little kids that we're treating. Mm-hmm. That's why they're struggling.
Yep.
That's, and everything. And I always look at it and say, that's stage 1 cancer.
Thank you.
Okay?
Yep. Canary in the coal mine. Yep. I'd even go a little bit before you on that. I'd say, Bret, even mouth breathing and snoring at night might even be, stage 0, we could call it even, right? That's that first sign. Yeah. Yep.
Yeah. sleep apnea, severe sleep apnea is stage 4.
Yes.
And so, I look at these and my whole thing was I can help these kids breathe. I've got the data that I'm helping these kids breathe and the symptoms are getting better. And they came in and there's like, but expansion doesn't cure sleep apnea. I said, I never said it did.
Thank you. I literally say that all the time. I'm going to be saying that if people listen to this before I speak, who will be at the show, you'll hear me say that when I speak. I don't ever say expansion cures sleep apnea. People always online are saying that. I said, I've challenged everybody. Show me one time in a recording or in writing anywhere where I have ever said that. That's not what it is. It's about normalizing anatomy to help enable people to breathe the way we are evolutionarily designed to breathe, which is through our noses. That's it.
Yeah. Now, I do have a ton of patients I have pediatric medical doctors that are board certified sleep physicians that are sending me kids because they're like, we can't figure out why this kid's got sleep apnea. Will you expand them? And they don't have sleep apnea. I'm not the one that's claiming I'm curing it. They can tell them because they're the medical side.
Yep. You're normalizing the anatomy, right? You're normalizing the anatomy.
And I don't know why the AAO is so against that.
Yeah.
The Journal of American Orthodontics and Dental Facial Orthopedics.
Right.
Okay.
Right.
They need to take the dental facial orthopedics off of that if they don't believe in it.
Right. And orthopedic is straight and pedic is pediatric. If you look at the origin of the term, it was started in the pediatric community. Orthopedic doesn't mean surgeon as we think of it today, as in, surgeon when you need to have back surgery or a torn ACL repair. I mean, that's who they are. That being said, the genesis of that term, I believe it was in the mid-1700s, 1741, was in the concept of helping children grow better.
Like you said, normalize them. So I believe it was Graeber in 1986 changed the name of our journal from AJO to AJODO, Tom Graeber. Mm-hmm. And that was, I feel ironically, about the time, and I talked about a little bit of my talk at Palooza, when we got away from focusing on the DO. When we added the DO in the name was almost when you look back historically. I mean, you go back before that, some of McNamara's stuff and Bell and Chaconis and Ricketts and Enlow and Moss and all of these things that were just all over our literature talking about the orthopedic Graeber and all over the orthopedic side of this. And then it just disappeared. We didn't see as much of it in the 90s and 2000s, and it became a lot of things from people who had a loud voice in the arena, and they tried to get everybody to think like phase one isn't a thing. And there was just a recent thing in JCO talking about how phase one, it doesn't have any evidence that it helps in anything with airway, and it's a whole nother discussion to get into. The point is, there is a lot of fear amongst our ortho colleagues because I feel they don't want to change, right? How hard it was for you to change, but you are built that way. Your whole life has been a series of changes. So you are uniquely wired and uniquely positioned and uniquely resilient to be able to do this. I also was my own boss, just like you. So I was in a position, Bret, where I could do whatever I wanted to do. When I wanted to invest in a CBCT in 2014, when the low dose first came out in 2013, the iCat Flex, I could do that because I didn't have to go to a partner or a corporate and say, can I get this machine? And I could, when I wanted to change my treatment protocols to focus more on airway, when you wanted to put the rhinometry in and pharyngometry, you didn't have to go ask anybody. So I think it's important we remember a lot of our colleagues, especially young ones, might not understand. They work for corporate, right? And they're telling them what to do.
They are. Or a senior doc who is old school, as we'll say it, right? I don't want to generalize that too much because, as you said, it's Dr. Is it Rorenhold?
Yeah.
He was technically, quote unquote, old school, but was extremely progressive and forward thinking. So I don't want to label everybody just by age on being that way. That being said, I shouldn't even say it was a lot of the older orthodontists. Some of the people that come at me most vocally online haven't been practicing, more than 10, 15 years. So it certainly spans the dogma spans the generations and spans the decades of age of practitioners. That being said, there are a lot of obstacles to doing what you've done. Again, there's so many obstacles that it's intimidating to people. If you're running a practice and it's really busy and you're a good tooth straightener and you're respected in your community and you're making a lot of money, what is the motivation to do what you did or what I did to change the way we practice? I mean, unless you have a core personal, and that's most of the people I speak with, whether it was a child a spouse, a parent themselves, that tends to be one of the biggest factors that I see that motivates people to think to act differently about this. I think a lot of our colleagues actually do think the way we think. They just don't want to put that into action because they're scared. I really think that.
So I need to tell you my pivotal moment. I guess I've had a lot of them, a lot of my, changing and things like that. But, the AAO and dental school says we don't touch kids until they're 7 or 8. And, that's kind of what I always did. It's like, well, come back when you're 7 or 8. That's when we treat you.
Same.
And I have a granddaughter that's almost 10 years old right now. And it was while I was going to the Vivos courses and learning about tongue ties and stuff like that. And my wife and I went to Canada. I think it was Mariana Height or something like that, was a dentist up in Canada that was teaching how to do baby tongue ties. And, I'm just like, yeah, I need to learn this because it's something new. Anyway, we're at this course in Canada. I think it was Edmonton. And my daughter calls me. Now, I shouldn't be emotional, but she calls me and she says, Everly stopped breathing last night. She's 3 years old. And she said, we timed her. She stopped breathing 7 times in a minute.
Whoa.
And she says, we don't dare not just sleep with her.
Yeah.
And I said, well, when we get home, let's take a look at her. And so anyway, we get home, we put her in the CT scan. Her tonsils are touching each other. Her adenoids are completely touching her soft palate. And my instant thing is I look at her and I look at my daughter and I said, we've got to get her to an ENT and we've got to get these things out. I said, that's why she's stopping breathing. And I never, ever really looked at her. She was a kid that had a lot of problems. I mean, she was emotionally all over the place. Beautiful. I think all my grandkids are cute.
I can attest to that. The picture on your website, your family is, those crickets are adorable. I love the one where you guys are by the fence post and it's like you can tell you've been taking a lot of pictures and the little guy, he's like walking away. He's like, I'm done.
Yeah.
I've had it. Anyway.
So I tell my daughter, I said, we've got to get her referred to an ENT and get these guys out. And my daughter changed my life. She looked at me and she says, Dad, she says, you say that you're the airway doctor. I can't, kids die on the operating table from general anesthetic. I don't feel right about sending her and having her go into surgery. And she says, what are you going to do? And I said, I've been doing expansion on these kids, but I've never treated a 3-year-old. And so I said, let's make a little baby expander. And the first one we made, we put it in and I said, okay, turn this thing once a day and let's see what happens. Within 6 weeks, her tonsils and adenoids shrank and she started breathing through her nose. And they had dogs her whole life. And all of a sudden she started complaining about the smell of the dogs. Never smelled them before. She had night terrors. She was bedwetting. I remember a time
she was in intense sympathetic overdrive all night long.
100%. And she had all of these, I don't know if they're called triggers or whatever. I mean, it's like she would just out of nowhere have a complete meltdown. Yeah. I remember going to lunch with them one day and she literally passed out in her food. Oh, gosh. She's sitting there and she just was like, boom, and she fell asleep with her face in her food. And this was before I treated her. Wow. And so, I did this little expander. We just did an upper expander on her. We've named it the Everly expander. And guess what? There's labs out there now, because I've told everybody this story, that you can treat a kid early. The youngest I've treated kids is 2.5 years old. I remember a mother that I had treated all of her kids with expansion. They all had airway problems. And she had this little 2.5-year-old that was running around, bouncing off the walls and just out of control. And we were up at one of my satellite practices. And again, I said, he's too young to treat. I remember her grabbing that little kid, getting in the chair, wrapping her arms around his arms, wrapping her legs around his legs. She says, I'm going to kill this child because he has put me to the end of the earth.
Mm-hmm.
Do whatever you have to do.
Mm-hmm.
And just desperation,
Yep.
this mother. And I was like, all right, so we didn't separate her or anything. We just took bands and we put them on there as this mom held this screaming child. And we made an expander. I had my lab tech there. We made it in an hour. We put it in, and she started expanding him. And 2 months later, he walks into the office and sits in the chair. You know, I don't know why, but I remember these are pivotal moments of like, oh my gosh.
Changing lives.
We can make a difference on a little toddler.
Yes.
Is it easy? Oh my gosh, it would be so much easier to wait until they're 7 or 8.
And that's, I think, Bret, why we wait. I don't say this as a criticism. I tell people all the time, probably sick of hearing me say it. Like, I try to call balls and strikes on this stuff. I do feel, and you heard me speak at Palooza, I feel I grant our ortho colleagues a fair amount of grace. People don't think I do, but I do. I try to, because I am one. And I went on this journey, and I didn't ever think the way we both now think. So I've been there. I've been in their shoes, literally. And I know it's scary, and I know it's hard, and I know the thought. I've heard a thought leader in our profession say on a podcast, not my show, on another person's podcast, I can't get my 5-year-old to take Tylenol. How am I going to get an expander in his mouth? And that was the justification for not doing early treatment. I'm like,
100%.
like what is your ability to manage a 5-year-old kid have to do with their need for our services? Nothing. And that's why I feel that the pediatric dentists especially are starting to eat our lunch on this, because guess what? They're trained on treating 2, 3, 4, 5-year-old kids. That's what they go to school for. And now where I'm at the pediatric residency in Naples, when I was in the orthodontic residency at Nova, I mean, it was a struggle to get a patient by 6 so that we could treat. And when I did, the feedback from other faculty and the leaders in the program.
Why don't you just wait?
Yeah. I mean, they literally, because there are times where the kid's going to be a little louder in the clinic, and you're going to have to work on that behavior management. And they're like, the child doesn't belong here. They're not ready yet. Now in the pediatric world, I mean, that's when they're seeing them. So we can go do these things young. But here I am now, because the orthodontic community didn't want me to teach them to do this younger. They literally didn't want to learn. The residents did. I'm going to make that very clear. The residents were amazing, and they totally understood this and wanted it. It was the faculty and the admin at Nova, just speak bluntly about it, that didn't want this. They wanted no place for it. I mean, there were other faculty members who said I should have my board certification taken away for trying to treat these kids earlier. So that's how strong the dogma is here. And now, in a pediatric residency, so what do I do now? Now, because I know just the story that you just told, I've seen it and I've heard it time and time again. And that's my why, the impact we can have on these younger kiddos and changing their lives and their families' lives, that I'm now forced to teach it to pediatric dental residents, because they actually know how to manage these patients younger. And the AAO better wake up and realize that the trend in this country is for more proactive healthcare. People are asking questions, and we have AI. And whether it's about, what's that?
Moms are going to change the world of orthodontics. Moms,
and the Maha moms, that it's not about a political movement. It's about a health movement. They want their kids healthy. They are sick and tired of their kids being sick and tired. And that's why they're questioning vaccines. That's why they're questioning fluoride. That's why they're questioning extracting teeth. It's not because they don't think we're smart or know what we're doing. It's because, and I really do feel COVID kind of pulled the veil back on the corruption of the medical community to say, like, they're not telling us everything they should be telling us. And it made people question things on a bigger scale, to where now parents are doing their own research. They are looking into this, and they're realizing, wait a minute, there's people out there who are going in and helping my kid grow better at a younger age, and that could potentially help them, or at the very least, detecting what the problem is and getting them to the right medical professionals and co-treating them, myofunctional therapy, whatever, the tongue tie release, whatever those things are, right? But back to the original point, Bret, you know how much, it's a rhetorical question for you, but to the collective audience, you know how much more time and energy and resources that takes to do that versus just saying, oh, cover my eyes. Let's see them when they're old enough to sit. Johnny's old enough and mature enough to sit in my chair. And of course, by that time, he's going to have a list of ADHD meds. He's going to be having trouble in school. He's going to be grades behind in his learning. He's going to be a trouble kid in many, many ways, and he's going to have no room for his teeth. So I'm going to pull a bunch of teeth and straighten them out and show their before and after picture of what a great orthodontist I am, because I gave Johnny, at least Johnny has straight teeth and a nice smile. I mean, I don't mean to be overly harsh, but tell me I'm wrong on that being where our profession is.
I got my own patients. I mean, I've been doing this, and I didn't bounce from one community to the next to get away from my bad orthodontics.
Yeah.
I'm sitting in a community of people that I took out teeth on that are now adults, and they're coming in to me. They said, I heard your radio ad, or my friend told me I have sleep apnea. And I look in their mouth, and this is a humbling experience to look in there and say, you know what? I took out 4 teeth on you. I didn't cause your sleep apnea. The orthodontics didn't cause it. You had it before.
Thank you. Yes.
And what I did is I didn't help it at all, but we do have a way of helping that. I want to say something about the orthodontic world that...
Before you go there, Brett, excuse me to interrupt for 1 second. I just want to underscore that too, that I am not saying, and I have never said, that the orthodontist is causing sleep apnea.
No,
and
it was there to begin with.
Thank you. That's why no studies are going to show that extractions cause sleep apnea in that sense, because I say all the time, it's not like a patient walked into the oral surgeon or general dentist or whatever to get their teeth, 4 premolars extracted, that they walked in a beautiful nasal breather, right, with perfect lip seal and no sleep disorder breathing. And then that night, all of a sudden, they're like suffocating, gagging for air. That's not a thing. The patient walked in with the problem, and you are just not recognizing it. So thank you. And then go ahead. Sorry to interrupt on that.
And so I look at our orthodontic community, and I truly believe that we don't need to have orthodontists anymore.
Explain.
That's a huge statement. The Invisalign world, the aligner world, the 6-month smile world, general dentists. I mean, there's multiple general dentists in my community that are straightening teeth. Mm-hmm. You do not need an orthodontist to straighten teeth. Mm-hmm. Okay. And I think that the general dentists that are doing the airway stuff are taking over, and we're treating the root cause of this. Mm-hmm. And we need orthodontists to become doctors.
Yes. Thank you.
Most orthodontists out there that are straightening teeth, taking out teeth, and lining teeth are tooth technicians.
Yes.
Okay. We need to become doctors of our patients.
Yep.
We need to be treating the patient, not the symptom of the crooked and crowded teeth. And I like Ben Moralia's statement that, crooked teeth and braces is straight teeth temporarily. Mm-hmm. And I look at the patients that I treated by just throwing braces on. Mm-hmm. What we do is, in an underdeveloped jaw, any orthodontic technique, whether it's braces or aligners or whatever that we use. I mean, the Damon bracket, they always say, you don't have to take straight. These Damon brackets are magic. We can expand with these things, and we do get good dental alveolar changes, but mm-hmm. we don't get skeletal changes with just braces. And so, by going in and doing skeletal expansion, and now we can do it on adults. Mm-hmm. And yet the orthodontic part is simple. I'm not an aligner guy. I know there's a lot of aligner guys out there. It has never been my thing that I'm really good at. And I can get things done so much faster and more accurate with a bracket and a wire. But I know there's guys that are great with the aligners. Mm-hmm. And so I don't discourage that. It's not something that works great in my hands. But, I mean, was it ClearCorrect or something like that was doing ortho without orthodontists? And, and they got sued.
Smile Direct Club.
Smile Direct Club. Yeah. Yeah. I mean, those guys were making teeth straight, and they look great. They weren't fixing any bites.
And by the way, there are leaders in academia in orthodontics who were some of the biggest investors in that company. True story.
It's because it's a moneymaker.
Yeah. Yeah. The same ones telling you and I that what we do isn't evidence-based and that what we do isn't the right thing. We're investing in Smile Direct Club. Yeah.
Yeah. So
for anyone who know, it went belly up about 8-9 months ago, and went belly up sometime in 2025, and is totally defunct now. I heard they're rebranding it under something else and trying to bring it back, but yeah.
But see, the orthodontist, if I think in the next 10 years, because of the awakening of the moms and the whole world on really the underlying problems behind those crooked and crowded teeth, that if we are still just straightening teeth in 10 years, and that's going to keep going, people are going to still make money. Mm-hmm. That's never been my ultimate goal in life, is to, make a lot of money. I do fine. I mean, every orthodontist does fine. Mm-hmm. But I get more satisfaction. I mean, yesterday I had a mom in here. Her 9-year-old daughter started out at a 2 and 3-year-old airway, 3 to 4 cubic centimeter nasal volumes. Mm-hmm. And we retested her after 3 months. She was at 7.5 and 8 cubic centimeter nasal volume. Mm. And this little girl, I said, we just doubled the size of her airways, and she's now considered an adult breather at this. And so the orthodontist world, I mean, I got a guy up the, 100 miles away that he's the $2,800 braces. Mm-hmm. And people come to me and they're like, well, why do you charge $5,000 for this? Mm-hmm. I can go to this guy for, $3,000. Mm-hmm. And I said, well, then you should go there if that's what you want, yep. If you want straight teeth. But I said, what I do is I'm going to help your child for the rest of their life. Yeah. And my hope and goal, I'm close to retirement. I have people all the time that are asking me, when are you going to retire? And I said, I am loving what I'm doing.
Yeah, you can tell.
Why would I stop now? Mm-hmm. I could have retired 2 or 3 years ago, but right now I'm looking for an associate that will come in and associate with me that I can help train, and then transition my practice over to him or her, whoever it is. And then from there, what I want to do is I want to go change the world. I want to go and I want to teach and educate. And if the orthodontists aren't going to listen, and I was one of the orthodontists, my little brother was doing braces a while ago, and I got on his case. Hey, you're not an orthodontist.
I used to be the same way. Yep.
Guess what I've done? I have now trained my little brother as a dentist to start expanding and growing kids, because the orthodontist won't do it.
I've trained many pediatric dentists and orthodontists myself, and my orthodontic colleagues get upset with me. I'm like, I tried to train you all first. I literally, when I started this journey, and if you need a hand as you're going out on that quest, I know a thing or two about the transition from private practice to this world. So I'm happy to help you through it any way I can. Don't be afraid to use me as a resource. I tried the first about 9 months. I said, I'm just going to go to orthodontists with this concept. I literally did. I tried to speak at the AAO twice. They didn't want me on stage. And yet I'm getting offers from state dental associations and regional dental associations and all these different internationally, I'm lecturing from all these groups, and the orthodontists don't want me anywhere near it. So finally I said, I'm done. My goal, as it sounds like yours is as well, is to help people live healthier lives. And
I don't care who's going to learn.
Yeah. I'm at the point where I'm like, if I can train them, and I've trained some GPs and pediatric dentists who are better than the orthodontists at doing it.
100%.
Yeah. I mean, literally, they get it. They understand it. They're not afraid of it because a lot of them have been treating younger kiddos already. So they're not scared to go in there. Interestingly, and I want to talk to you about this part of it, but when you're talking about Damon not getting skeletal expansion, I agree. In the older kids, it's dental alveolar. This is another place to challenge you on that. I know you like to think about things, so we can talk about this more off air. But I was doing it with turnkey expanders on these kids for about 6 years, and no one loves expanders, right? They're not the most fun thing in the mouth. They cause challenges. There's more emergency visits and tongue ulcerations, and they can't really be doing myo while they're in. And there's just a lot of challenges there, and feeding challenges as well in some of the kids. So I had some patients with special needs. I tended to treat a lot of patients with special needs and that were on the spectrum. In my community, we tended to have quite a few. And as well as I was really trained well in dental school by Dr. Fred Ferguson on how to treat patients with special needs without medication. And so I had experience in that. So again, I was comfortable with it. Most of our ortho colleagues aren't. And I'm not saying it is anything special about me. I was just blessed that I learned it in dental school. And so I started treating these kids younger, 6-year-olds with special needs. And I had a parent who said to me, Mom, I looked at, it was 2 in particular in a pretty close period of time, about 2011, 2012. And I've been doing these expanders. And the mom, at this point, people were coming to me, they knew I did this. They were coming to me because most of the other orthos in my town were extracting a lot of teeth and I wasn't. So I was being sought for that service, and the parent comes in and the boy had Asperger's, and Mom's like, he just has tremendous sensory issues with his tongue. And if you put, he's not going to tolerate anything by his tongue. He will literally rip it out. We won't be able to do it. I said, I don't know what else I can do. I mean, he had impact. Canines were going to, actually, I picked it back. He was 8, excuse me. I said 6. He was 8-year-old. And I said, I don't know what else I can do, really. Like, I can't really do anything. If I can't get expanders in there, I talked about removable. She's like, he won't put them in. There's absolutely no way. So I said, okay. I said, she's like, but if you send him to get teeth out, Dr. Mike, he has to be put under general anesthesia every time he goes through a surgical procedure like that. So I said, I'll tell you what, let's try some braces and wires. I'm like, I don't know if it's going to work. I don't think it's going to, but it won't hurt. I'm like, in the lower arch, it should work at the very least, because what we do in the lower at that age is dentalveolar tipping anyway. I'm like, so I'll get more room in the lower. His lower laterals were blocked. So we'll get more room in the lower. The upper, we'll just see. And maybe this will desensitize him to the point that after he's had me in there for a while, maybe I can get an upper expander in on him, and we can kind of try to expand him then. We tried it. And I had another patient with a similar set of circumstances close to this, Bret. And I went back, I've since scoured the literature, and it's well within our literature. Melson talks about this going back to an article she had in 1975, and I believe it was JCO, where the patency of that suture, what Vig calls it before the age of 10, that infantile suture. It's wide open. It's like an open highway through the center of the country. When you deliver, and Ricketts had a lot of studies on this too, that 400 grams of force, when you came out with a W arch and the quad helix, 400 grams of force is enough to get orthopedic skeletal change in a young child. Again, young. They have to be young. Yeah. So when you apply that amount of force, we use wires that easily deliver 400 to 600 grams of force. So I started looking, and I would literally be calling my clinical team over, like, you have to see what's happening. I can't even believe it. And I had, at this point, I didn't have CBCT, but then I started taking pre and post CBCTs, and you see the remodeling of the palate, the orthopedic change. They don't get a diastema because it's slow. Just like if you put a quad helix or a W arch in, you're not going to get a diastema. Problem with the quad helix and the W arch, they're very difficult to manage clinically. They're cumbersome, and they're hard to reactivate, and patients just struggle with them. And I never knew how much how much force is in there when you can use a force gauge, but when you collapse it back, it tends to want to rebound, and there's NiTi expanders. But anyway, the point being, the literature is full of evidence and data showing that you get comparable changes even in the nasal passageways. Martina has a great study on that, where you get changes in the nasal volume in, again, young kids just using braces and wires. So I developed protocols and started doing this exclusively as of like 2012, 2013. And then when I got my CBC in 2014 and saw that I was getting this orthopedic change, they look so much better. I'll have to show you some cases. The arch form is better. Where we need the space the most in the middle and anterior thirds of the arch, because a lot of these kids, especially the ones without a crossbite, they have these narrow V-shaped arches, right? They're collapsed in. Sometimes the molars aren't that narrow in those kids. And I'd always struggle because I'd expand them, and I've got my molars out wide, or sometimes wider than I want, but in the anterior middle third, I'm still constricted, and I'm waiting for phase 2, and the canines don't have room. That's gone. Your canine impactions literally go away because you're using a broad arch form. So you're developing. I mean, I have cases I'll show. I'll get 2 millimeters across the 6s, the permanent first molars, all I needed, and I'll get 12 across the primary canines because you're just by arch form with just an arch wire. And I am convinced, because this is all related biologically, with getting them that space when they're young, especially in cases, some cases you combine with myofunctional therapy, that tongue gets up there and does the hard work for me. Whereas with the expander, watch some cases, you take the expander out on even a 7-8-year-old kid, and you'll still see their palate is kind of high and vaulted. Like they have a broader arch form, but the palate still has that like high vault in the center. And those cases on me almost always relapsed. Even if I had them in like a Holly, they almost always relapsed. And I'm re-expanding in phase 2. That goes away because you make so much tongue space that the tongue can so beautifully sit up and mold the shape of the palate. And the airway problems like literally disappear in the kids that have airway problems. So yeah, it blew my mind doing it. And then I went back and looked at the literature, and I'm like, wait a minute, it's all about forces. The teeth don't know whether we're pushing off the lingual, in an 8-year-old. The teeth don't know if we're pushing on the lingual or pulling on the buckle. And anyone who's ever made a quad helix or even an expander, a Hyrax in a patient who's really narrow, that thing's not up super high. It's the line of action of force is very, very, very low. So yeah, it's something, it's just transformed how I think about phase one, and it becomes more profitable, which is nice, because another reason people didn't want to I call this out. People say people who do phase one are doing it for the money. I actually say the opposite, and I see you shaking your head, saying no, in agreement with me.
Just do phase two.
Say that again.
It's way more profitable just to do phase two. It's not.
Thank you. Completely more.
Way better money if all I did is wait until everybody is phase two.
Thank you. And that is the big thing that people don't want to talk about. They say, "Oh, you're doing this for the money." Well, when I was doing it with upper and lower expanders, it was hurting my bottom line pretty tremendously, because it was a lot of money, lab fees and visits. And this was before 3D printing. So, I mean, you were doing everything with pickup impressions, and, it was a lot. Fitting bands. When you go to braces and wires, and first of all, the kids love it. It's one visit. You put the brackets on. You have to have, there's certain techniques. I'm simplifying it, but you have to disocclude them with bite ramps to minimize the interocclusal forces, and et cetera. But you follow this protocol, which took me years to develop and perfect. You all of a sudden, you leave these kids, sometimes it's like 4 or 5 visits, and then you take their braces off at 12 to 18 months, depending on if you're waiting for teeth to come in or not. And they look amazing. They love their braces. They're like a star of their class. If there's an emergency, it's because a primary tooth got loose a little early, or maybe a wire's a little pokey, but there's ways to mitigate all that. It transformed my practice, and it becomes much more profitable for phase one because the visits are way down. So your fee, and you can charge a little more because you're offering something that no one else is, and you've invested the time and energy and resources into it. So, I found that was really great. And I had so many people that basically, would come to me for that service. So, oh, who's that?
So you heard me talk about Everly.
That's Everly. Everly, you're famous.
Smile big.
Yeah, look at you. How you doing? I'm Mike. Nice to meet you, Everly. What's that?
And she's had 2 expanders.
Okay.
Yeah. And so
this had braces.
Yeah.
Yeah.
So this is if you look at her cool eyes, my wife is half Japanese.
Yes. Yes. That's beautiful. Absolutely. That's great.
Anyway,
we were talking, Grandpa was bragging about you, Everly.
Yeah. And you're how old now?
I'm almost 10.
Almost 10. Yep. And I see her sitting there talking to you with her arms around you and breathing beautifully through her nose with her mouth closed completely. And Grandpa was telling me about how you didn't breathe so well when you were little.
Yeah.
Yeah.
She's like a big part of what changed my life. This little gal right here.
Yeah.
So I'm so blessed that we've been able to help her out.
No,
so it's kind of cool that she showed up here right here,
right
close.
As we're winding down. That really is. I mean, that's real. I was wondering when I saw her peek across, and I was like, I wonder if that, but she looks so big. I know you said 2.5, but they grow so much. So you said you're 10 now? I'm
turning 10 in April.
Turning 10 in April. Okay, good. Wow. I'm getting big. Pretty cool. So you got a really special grandpa. You know that?
Mm-hmm.
What do you call him? Is it grandpa or papa or?
Grandpa.
Grandpa. Okay. Yeah. Well, your grandpa's a really.
Call me Papa or Hey You or whatever.
You're very lucky to have him, not only for what he did for you, but what he's doing for a lot of other people.
Yeah.
Yeah. And for those of you who are listening only, she's wrapped her arms around him and had to give him a big old hug. So if that doesn't summarize what this is all about, Bret, I don't know what does right there. I mean, that is, we can talk X's and O's all day about how we do this in different ways. But at the end of the day, man, that is so cool that just happened. Unscripted.
Yeah, who showed up. I mean, they're coming in we've got a company that's going to help us do some videos and stuff. So it's all about education. I've got 2 days of me doing a whole bunch of educational videos. Number one, for our patients, so that they can learn before they ever come to my office.
Yep.
But I mean, we do in-office courses, and we have all these doctors that want to come in and learn from us. And kind of going back to what, my transitioning into, retirement here in probably the next 5 or 6 years, I'm not going to give up when that happens. My goal is to train as many docs and parents and everything like that in what we're doing.
Yep.
The mission in life is really to improve everybody else's quality of life. And
That's it.
It's pretty cool.
It's pretty cool. And actually, as we wind it down here, I actually just in the intro to this show, I announced that I don't even know if I've mentioned this. I don't think I've mentioned this to you. Starting this fall, my good friend and colleague, Dr. Camacho, and I, who's in Fort Lauderdale, we're going to be starting a 2-day in-person course to teach this.
Cool.
Because of what you just said. I have so many people, I've had online courses, and so many people say to me, I would just love to learn this in person. So we're going to do 1 day, a little over a day in a hotel room right on the beach in Fort Lauderdale, Hollywood area. And then we'll do in his office the second day, and we'll have live patients there and show how we do all of this. And for that exact reason, to be able to help and treat some of these patients and show people, because I knew what I could do with my own 2 hands. And when I phased out of my clinical practice, there were, and it's going to happen to you, Brett. I'm telling you this not because it's about me, but just to anticipate it. It's hard in certain ways because you have made had such a profound impact on your community, and you've changed so many lives. Even if you bring someone in to quote unquote replace you or fill your spot, you're not replaceable, but to fill your spot, it's different. And you're going to have a lot of people who are going to question that. I mean, I'm humbled by this. I literally had parents that were in tears, and they're like, you did this for my older one. Like, you have to stay. And what I would continue to tell them, and maybe just tuck this away somewhere, is if I just stay here doing this with my own 2 hands, there's so many.
Treat this many people.
Yeah, I said
if I go this way, I can treat. We have to change the world.
Thank you.
And that's what we have to do. We have to completely change the orthodontic world.
Yes. Yep. Yeah. That's it. Yeah. Well, I'm gonna let you say it again.
I said it's exciting, but it's also very daunting.
It is daunting. And, I think you and I are people who are uniquely positioned to take on that challenge because we've been through a lot. You certainly more than me. We've been through a lot. And those who know my story know the challenges I faced throughout my journey. And it's going to take people like us who are young enough that we still have the fight in us, that we want to go fight this fight. Because I'll tell you, it is a dogfight. Like, it is, they come for you, and you have to be prepared for that. And you clearly are. And it's not for everybody to go out and spread this message. And so those people, we just have to hope we can teach them so they can make a difference with their 2 hands. And then it's our job to go out and spread the word that we can share this with other people to change as many lives as we can change. And I get emails from docs I train and coach all the time. They'll send me a case of a before and after, or a testimonial from a parent who, just showing and it's everything. I'm like, if I stayed doing it with my own 2 hands, that patient's life never would have been changed that way. And so that's how I have to think about it, because I do miss some of the day to day and, having that impact directly. So as you're coming down and facing that part of your journey, always keep in mind would be my suggestion that you're going to have an impact on a much grander scale, macro scale, not grand, literally meaning better, but just grander in terms of the size of it, the magnitude. So, well, listen, this has been an amazing time. It's one of the longer episodes I've had, and I feel it's flown by. I've so enjoyed this conversation. I've enjoyed getting to know you better. I can't say enough how much I appreciate your honesty and your openness, and for what you're doing for this community. You really deserve to be acknowledged for that. And the sky's the limit. So keep healthy, keep doing those triathlons, keep yourself healthy, because you got a lot of years to change a lot of lives.
Well, thank you for letting me be on this. It's going to be great. Go forth and go upward.
Absolutely. Yeah, for sure. So keep up the great work, and congrats on all you've done, your beautiful family. And I'm excited to continue to work together in the upcoming years.
All right. Sounds good. Have a great day.
You too, Dr. Bret Christensen. Thanks so much.
Mm-hmm.
Bye. Thank you for tuning into this episode of the Doc Podcast. Be sure to visit theorthocoach.com to get access to ADA CERP recognized CE courses, or to schedule a private one-on-one coaching session with me. Also, if you know of someone who would make a great guest for this show, or if you'd like to be a guest yourself, please email me at drmike@theorthocoach.com. And be sure to join the Doc community on Facebook for more great content. Thanks so much for listening, and always remember, you have been blessed with the ability to do amazing things.